Hi, everybody. This is Carrie Hamblen, the CEO and president of the Las Cruces Green Chamber of Commerce, bringing to you again another one of our special series, What's New at DACC, where we are spotlighting all of the incredible faculty and staff and programs at Doña Community College. And today we have with us Assistant Professor Ashley Rodriguez and Instructor Angela Guerrero from the Doña Community College Nursing Associate Degree Program. Ladies, it is so lovely to meet you. Thank you so much for joining us today.
Awesome. Thank you for having us. It's very nice to meet you too.
Well, you all have been with DACC for a couple of years, but you are long-term nurses who have got a variety of skill sets. And full disclosure, my mom is a nurse. I've grown up in the nursing community, and I have such mad respect for you because Angie, as you were talking about, working during the pandemic, just all of the different challenges. And, what makes, you can't have a better group of people working with potential nursing students who have gone through these real life experiences. And so, as we get into this, the nursing program at DACC offers both licensed practical nurses certification, so we know those as LPNs, and the Associate of Nursing degree where people can get their RN. So can you tell us about the differences between the LPN and the RN for students who work in the medical field?
Yes, definitely. So our program is actually a little bit more unique. So it's considered a career ladder program. So our program is 4 semesters long. We call them trimesters because they're a little bit shorter than that normal semester. But for the licensed practical nurse certificate, it takes about 3 semesters. And then these students can begin, they get their certificate, they can go take their licensure exam, and then they can begin working as LPNs while they're finishing out their associate degree, which takes about another semester.
And so with the LPN though, this is really kind of to get them working out into the field, and then if they so choose, they can go for the RN position, correct?
Yes, and we kind of have it set up in a way that, if a student says, you know what, I've got a lot of life stuff going on, I just need to get working. I need that that little bit better paycheck. I need to get working. So sometimes we have students that stop at that LPN level and they go and work. But the majority of our students go, it's one more semester. Let me just push through and get my RN.
Yeah.
We also have the option where students, if they do step out as an LPN, or maybe they've gotten their LPN somewhere else at a different college, they can come in and they can complete their associate degree, and that takes about 2 semesters. But yeah, we have students that come in as LPNs and they get their RN pretty quickly.
And so what's the difference between LPN and RN? I mean, besides the certification, but I know that there are um, different things that they can do that they're allowed to legally do, right?
Yes, yes. So it's all in the scope of practice. So for LPNs, we typically think of like your stable patients. So a lot of LPNs take care of patients at like skilled nursing facilities, rehab facilities, maybe doctor's offices, clinics, things like that. Whereas the RNs can do a little bit more. They will do a little bit more invasive medical procedures. That's typically who you'll see in the hospital setting. They do a lot of manager positions as well. So they oversee and supervise LPNs and maybe some other healthcare workers as well.
Hmm. Both still are very demanding and very important, certainly. And so, there's been an expansion for this program down in Sunland Park, and I have a feeling that is because the demand for trained medical professionals have changed. How have you both seen that? And if you want to talk about the program down in Sunland Park.
Yes, definitely. So we expanded our program at Solon Park in the fall of 2023. We started with 8 students, and now we have about 40 students enrolled here.
Wow.
What's great about our program is that it's a fast-paced program to get students into the workforce since we have such a shortage of nurses. And I really love that we do have two options for our students because sometimes life happens and maybe a student cannot complete the program for whatever reason. And so at least with the LPN certification, it allows them to step away with something where they're able to enter the workforce and come back whenever they are ready. Here at Sunland Park, we have seen a need for medical offices and even hospitals because
Mhm.
it's growing with Santa Teresa being nearby. Right now, our residents at Sunland Park, unfortunately, they have to commute to Las Cruces or even, out of state to El Paso. So we're seeing our medical partners are taking interest in this area and talking about building facilities, clinics, and even like a micro hospital with different specialties.
Well, and we're seeing that so much, especially since our rural parts are rapidly growing, and people are moving there. And, it is frustrating and sometimes a matter of life or death if you can get to a facility in 2 minutes or 20 minutes.
Right. Yes.
Um, it's so much. I mean, and it's so important. And I know that both of you really take that responsibility very seriously, and understanding since you both also worked in the field and now are really kind of training these future nurses. We Ashley, you talked about kind of the differences of the LPN and the RN. But also you're preparing them for like different work environments because it's different from working in a doctor's office or a clinic to working in a hospital or an emergency room. So how do you kind of prepare them for that? Because in some cases it could be a little shell shock, of going into an emergency room right away.
Yes, definitely. So a lot of our program it's blended. So we have classroom instruction. This is where the students are learning about the different disease processes and what are they going to do, how are they going to help the patients. But then really it's extensive hands-on experience, clinical experience. And so we do this a lot by using simulation.
Mm,
So we have mannequins we have simulation labs in both of our campuses. And we have these high fidelity mannequins that our simulations operator creates these, with the help of our other faculty, of course, but she creates these scenarios and it allows students to, that real life, they get to be the nurse in this safe learning environment. And we start at a, very basic, like students when they're in their first level, they start out, their simulation is like helping a patient to the bathroom, and this patient is weak, and which seems simple enough, but for a brand new student, this is very scary.
hmm
And then by the time they get to their fourth level, getting ready to be out there, working as an RN, our that simulation is very complex, and the patient, our nurses, our students, end up having to do CPR on the patient. So we're preparing them for those real life experiences. And we actually recently just had a student that told us, shared with us that he had that simulation practiced, and then the next day when he was at clinical, he had that exact experience. And so he was able to use the feedback and the training that we provided him in the sim lab on a real patient.
I think it's probably come a long way. I used to be a certified CPR instructor. In order for us to get certified, we had to make sure our compressions were deep enough. And
Mhm.
so our Recessa Annie had a little EKG readout. I know it's much more complex now, than in the olden days when you had a little EKG that attached to the Recessa Annie that measured your compression. So, that sounds fantastic in terms of the technology and just being able to meet people where they are. And I think that's the benefit about community colleges, period, is that like Angie, you were saying, sometimes people have experiences and life gets in the way and they have to step back. And I think that's just the beauty about, especially about DACC, is that when they're ready to come back, they can come back and they can finish up what their schooling is. And so as we finish up today, nursing is a hard job. And so I'm wondering when you get people who come and talk to you about, hey, I'm interested in the LPN program or I'm interested in the associate in nursing, what do you tell them to kind of prepare them to be like open for everything that they're going to get in this program when they start?
So at first, when students come to visit us and they tell us that they're interested in nursing, it's coming from a place in their heart where they care about people. And so at at the core, that's what we want to produce. We want to produce compassionate caregivers. We do like to remind them that it is a fast-paced program and that with that, there's challenges that come along, but there's also resources that we have. So students are provided with a mentor when they start the program. We also have tutoring in our program, and we have help from other areas in the college that could assist with our students. For example, we work really close with our Avanza program. And
Hmm.
so they provide like food assistance, technology, iPads, laptops for
Oh,
maybe students who don't have that resource. Another office we work closely with is with our accommodations office. So sometimes we have students that come in and they may share they have a disability. And they think that maybe nursing isn't for them, but we accept them and we say, no, you can definitely be a nurse, but you're just going to need some accommodations. And so that's private between the accommodations office and the student. We just get a list of what their accommodations are.
and that always helps because, I think what's really important is that, there are going to be patients who also have disabilities. And if they don't see themselves
Right.
in their practitioner, then they feel kind of like, as an outsider or excluded. And so we have to have that representation. I think that's great that there are
Yes.
those accommodations. Ashley, what do you tell people?
So definitely one of the first things is I get them or try to get them in contact with one of our academic advisors. This will help really set them up for like, you know, letting them know what do they need to do? What's the fastest way? That's usually what they want to know is how can they quickly get the degree or the certificate to get working.
Yeah.
And then I just really have to mirror what Angie said. Like our support system is great. I wish I had a support system the way DACC supports our students when I was going through college myself. But I just I can't brag about it enough. We do also, along with the mentor, we do also have a student nurse navigator who really is just another person, another resource to help our students kind of guide their way through the program and through, everything that goes on because it is like I said, it's fast paced, but it's well worth it.
Yeah. Well, one of the things, just in terms, because my family is so very much in this field as well, is understanding the pinning ceremony.
Yeah.
And that's a big deal. And it happens at the end of every semester or when you have graduating class. Can you kind of give us the rundown about why the pinning ceremony happens and what's the significance of it?
Yes, so it really has to go back to like I feel like the days of like Florence Nightingale, and there really is something special about the pinning ceremony. So this is where it's more of an intimate ceremony. It's not like graduation where you have hundreds of thousands of people watching you walk across the stage, right? So this is a lot more intimate. It's our graduates and their families, and the families come up on stage, the graduates come up on stage, and they literally they put a pin, and this is our way of welcoming them into the nursing profession. And a lot of students tend to do that instead of graduation because, like I said, it's a lot more intimate. It's a lot more like nursing and healthcare profession oriented. With that, I'll say that, we've been fortunate enough that we have been having about 25 to 30 graduates about every term. And we do that 3 times a term. So it's
That's
great.
amazing. Angie, what was your pinning ceremony like when you had it?
Memorable.
Yeah.
And I think that a lot of students will share that their pinning ceremony was memorable as well. You never forget it, being pinned by your family, um,
Mhm.
taking that responsibility to serve the community. Um, you'll always remember it.
Yeah. Well, also it really kind of reinforces, because especially being a medical provider and being a nurse who's at the front line of everything, it really kind of reinforces that you're part of this family, that you're not alone, that you're part of this really special family who is doing something that is very selfless, and serving the community. And it's kind of that reminder that, this is something that's really special and really important.
Yes, yes.
Agree.
And I'll have to say, like, one of my favorite parts of pinning is not only seeing all the families, because you see like the little kids and stuff like that, but also at the very end, we do a lighting of the lamp. So this is lighting of the lamp
Mhm.
of knowledge. And then we do a pledge. And we invite all of the nurses or any healthcare professionals in the audience to stand up and say the pledge with us. And so it's just such a
Oh,
nice like way to close out the ceremony, just because you see everybody kind of come together and share that.
and really get it, really get
Yes.
like this is an important day for the rest of this. And it's just, I mean, I could go on and on because I think just what you do is great, and really grateful for it. And so, we've been talking with Assistant Professor Ashley Rodriguez and Instructor Angie Guerrero from the Doña Community College Nursing Associate Degree Program. This is part of the What's New at DACC. It's a monthly series in partnership with the Las Cruces Green Chamber of Commerce to help highlight the people and the programs that are available to students throughout the state. And so whether you're just out of high school wanting a new job skill, finished raising a family and want that college degree or more, you can check out What's New at DACC by going to their website. You'll see that either above or below, all depending on the platform. And these videos drop the first Tuesday of every month at 3 o'clock. And in the coming months, you're going to get to meet some more incredible people who are adding to the success and diverse training and education programs that are available to every single New Mexican. So ladies, thank you so much for all that you're doing. Very grateful, and it was so lovely to meet you. And I know that the upcoming pinning ceremony is going to be just heartwarming and emotional and satisfying and just inspirational. So I'm glad that you're able to participate in that as well. So thank you so much.
Thank you. Thank
Thank
you
you
for
for having
having
us.
us.
Absolutely. Y'all have a great day.
Thanks, you too.